8 years ago, Marilyn Kenny suddenly had trouble walking, and then her speech started to slur.
And unfortunately, I waited a couple hours too long, just waiting to see if whatever I had was going to pass.
Kenny was having a stroke, a sudden loss of brain function that affects one Canadian every 10 minutes. Kenny is a former nurse, but even knowing the healthcare system didn't help her find all the answers she needed as a patient.
And then I started to feel, well, there's an awful lot that ordinary people who aren't in medicine would not have any idea of how to go about. And they feel lost. I hear your husband has had a bad time of it.
Kenny took her passion for helping others and became a founding member of the Peers Fostering Hope program, which pairs former stroke patients with new stroke patients and their families. Sunnybrook Health Sciences Centre was one of the first sites in Ontario to implement it. Beth Linkowicz is director of the Regional Stroke Network and says focus groups identified a need to better support patients throughout their care.
Just even having conversations about what resources are available and what they might be able to expect as they move from acute care to rehab, or even just answering questions about, what they went through.
A lot of it is just minor adjustments at home.
Volunteer peers go through special training to help prepare for their role. Kenny is one of 2 peers helping patients and families at Sunnybrook.
There have been many patients that said to me, and I quote, "Now I have hope. Now I can get started and I have hope." And that was just remarkable to me. That's exactly what we wanted.
It really helps to empower the patient so that they're able to ask questions that they need to ask and get perspective on what's going on.
The hope across Sunnybrook and other centres is to expand the program, knowing there are about 315,000 Canadians currently living with the effects of stroke. With Sunnyview, I'm Monica Mattis.